Yeah, you can see from the way she's standing how difficult it is for her. She's trying to overcompensate on the left side of her body because her right leg obviously hurts her a lot, and you can see how poor her body condition is and how hard it is for her to support weight on this leg. Her heart rate is also 80, which is very elevated. Dr. Jean is going to get her some pain medication. She's pretty severely dehydrated. You can see how slow her jugular refill time is. So normally I would grab IV pain medications, but in her case, her circulating volume is so low that I actually think it's safer for her to have pain medications orally. So we're going to get those on board, and then we're going to take some radiographs of this right hind leg. Oh, she's having trouble chewing. This horse is really unsteady.
Who else is doing random?
I don't have to. Ooh, she's got a ton of ulcers on her tongue.
No.
You guys see how
Sorry, didn't mean to
all of
scratch
the redness, I know it hurts, honey. So she's got ulcers on her tongue and on her gums. Okay, I'm sorry that hurts.
you. Oh, we're not doing it anymore.
Okay, I'm
We
sorry.
know.
Look, she's worn the edge of this hoof down because she's dragging it. She's scraping the edge of this hoof off. I'm not sure we're gonna see anything on radiographs. Everything that I'm palpating is all soft tissue.
Okay.
But see right here, so that is origin, insertion point of soft tissue stuff. Let's just keep going down. Yeah. Ready?
Yep.
Good job. So that's abnormal right there. That is probably the insertion point for the soft tissue that's
Oh,
damaged
that
up
little.
here.
Okay, that makes
Yeah.
sense. You want DP top?
I want to shoot this
Yeah.
direction if that's okay.
I got it.
Let me know if I need to adjust. That should have been good. Let's see if we were oblique.
He has a tiny bit, probably.
So you can see there should be 2 more joints associated with the hock, and they're in various states of collapse right here. So here's a joint space, here's a joint space, and we should see 2 more joint spaces here that are non-existent.
So you basically
Let
completely.
me look at
Lower
the
weight
lateral of this hock. I might want to retake
bit.
it. Let's
weight
try
bearing now.
lateral of the hock one more time. Sorry.
You're good. Let's do it.
Oh yeah, weight bearing would be perfect.
Oh, you
You're all
were.
right, sir. Ma'am, why do I keep calling you sir? Ready?
Right there, right there. Yep.
We just took radiographs of this sweet older mare. She clearly has a lot of pain associated with her hind end. She's very unstable. She's overloading all of her weight onto her left hind to get weight off of this right hind. She's very unsteady, and on palpation, we suspected that it was primarily soft tissue. When we took radiographs, we found that there's also a significant bony component. This joint right here, the hock joint, should have 2 more functional joint spaces than this mare has. So 2 of her joint spaces associated with this joint have kind of crumbled and collapsed into each other. And she's got a ton of heat and pain. I can feel heat coming off her leg this far away. So she's very, very painful on this leg. She's been so sweet. She's not sedated. She let us do everything that we needed to. And I'm gonna recheck her heart rate. We did give her some pain medication orally because she's very severely dehydrated. And I didn't feel safe giving it to her intravenously. So her heart rate is 60, which is still 20 plus beats per minute higher than average. She also has a heart murmur. These intake days have been really tough. So far we've had 1 horse out of the 7 that we've looked at that didn't have something catastrophic. wrong. So it is really difficult. We just get sometimes pictures of these horses ahead of time, and we're always optimistic that we have problems that we can treat and animals that we can save. And it's really heartbreaking to have so many horses come in with problems that we can't solve. Adele's hock radiograph isn't the worst hock radiograph I've ever seen. Certainly it would have been career ending for her as a riding horse. That radiograph definitely wasn't the reason why we made the decision to give her the last act of kindness. If that radiograph had been the only change, but she wasn't dragging that leg around, we wouldn't have made that choice. Osteophytes, which is what we saw in the bottom part of her joint, are an indication that inflammation has been happening from arthritis for long enough that the bones have remodeled in response. The layman's term is joint mice, which I think is funny. They're little pieces of bone that hang out near the joint. And what they do is they make sharp points, and then those bony points hit each other. So when a joint would be moving through flexion and extension, instead of being able to move through a range of motion, you're having little bony, sharp pieces of bone hit each other, and that's very, very painful. So one of the reasons why we assess range of motion is one of our first indicators that this process is happening is a reduced range of motion. So in Adele's case, her range of motion in her hock was severely reduced, and we didn't challenge her on that, especially not after we saw that radiograph, because we didn't want her to cause discomfort. The joint collapse is significant because our joints are designed to have a synovial structure, the articular cartilage, and then joint fluid to cushion and lubricate and help those soft tissue structures slide across one another. When inflammation and arthritis happen, the viscosity of the joint fluid breaks down and it gets more and more watery, and then we have the articular cartilage touching each other, which it's not supposed to do in this joint. And then over time that grinds off and you just have bone grinding on bone. And anybody who's had severe arthritis can understand that that's extremely debilitating and painful. Over time, those joints can arthrodese, which is a fancy word for saying enough osteophytes form that they fuse the joint together. So there's no more joint. And actually when that happens, after years of arthritis, sometimes you can have an animal that was very painful become more stable and more comfortable for a period of time because that joint can't move. In Adele's case, there wasn't evidence that that had happened. She just had bone grinding on bone every time she tried to use that joint. Ultimately, for Adele, her decision to give her the last act of kindness had to do with pain, and our assessment of why she was painful. The primary assessment for her pain was severe soft tissue damage, likely tendons and ligaments torn, combined with neurologic disease. Her central nervous system was abnormal. Her brain didn't know where her hind legs were in space. Combined with oral ulcers. We didn't run blood work on Adele because we didn't need that information to make an answer, but I suspect if we had collected blood from her, we would have found that she had renal insufficiency. One of the main causes for oral ulcers is built up uremia in the system that can cause ulcers. Her body condition score was so severe that she was at an advanced risk of refeeding syndrome. We would have had to carefully refeed her and stabilize her organs before we could safely give her daily pain medication, but it wasn't fair to even try to do that because she would have been very, very painful. Heart rate of 80 is extremely high. Heart rate of 60 isn't controlled pain, even with pain meds. We did give her that dose. And so you're always playing this game where you're going, I might be able to fix one problem, but I'm going to make another problem worse. This is something that as veterinarians, we take an oath to do no harm. While I want to save every animal I possibly can, it's why I went to veterinary school, I took an oath not to make things worse. And sometimes as humans, we make ourselves feel better by saying, well, at least, we gave them a little bit more time, but my job as a clinician is to advocate for my patients. So if it's your dog that's suffering and I see you in a vet clinic and I think your dog is ready to go, my job is to tell you that whether your heart feels ready or not. And it's extremely difficult in a shelter setting, not just because of the setting, but because our buyout days, we're triaging and looking at dozens of animals at a time, sometimes as many as 50. And I'm so grateful for Dr. Gina because she and I have to make a lot of really hard calls, and having that colleague that you trust and can lean on and go, hey, this is what my gut is telling me. We also have amazing support staff at Horse Plus, and we have in some cases, people who've been doing this for more than 2 decades to fall back on. So we never, ever, ever want to make the decision to give the last act of kindness prematurely. That's why we use evidence and we back up our decisions with evidence-based care. But often the most important part of my job is to alleviate suffering. And in a lot of cases, do no harm means choosing to advocate for that patient and not allow their suffering to continue.
If you have an older horse or you have a horse that has problems, please take it to your veterinarian. Don't let it go to an auction or give it away to somebody, because you're seeing what the reality is of what happens to horses when they have medical conditions and they're thrown away. And there's a lot of really amazing horses that go through auctions, and there are very hidden gems through this buyout program that have gone on and lived amazing lives. But sadly, there's just so many that are so broken, and we can take to heart that they're no longer suffering.